My name's Christy. I'm going to do your examination today. Can you tell me why you're here?
Just a regular checkup.
Okay. I want to ask you a few questions. So, do you have any medical problems?
I don't.
Okay. Have you ever been in the hospital before?
I have
For what?
for pneumonia.
How long has that been?
3 years.
3 years ago. Okay. Do you smoke?
No.
Do you use any smokeless tobacco?
No.
Do you use alcohol?
No.
Okay. Do you use any medications?
I use an inhaler for asthma.
Okay, so you have asthma. All right. How often do you use the inhaler?
Not very often.
Okay, just when you need it?
Yeah.
Okay. Let me ask you a few questions about your mom, okay? Is she still alive?
She is.
Okay, does she have any problems? Any health problems? Any heart problems, lung problems, anything like that?
No.
Okay. Let me ask you about your father. Is he still alive?
He is.
Okay. Does he have any health problems, any heart problems, lung problems, anything like that?
He has high blood pressure.
High blood pressure, okay. Let me ask you about yourself. Do you have any heart problems? Have you ever been diagnosed with any heart problems? Any lung problems besides asthma?
No.
Okay. Any endocrine problems like diabetes or thyroid problems, anything like that? No, okay. Well, at this point, I would wash my hands. What we're going to do right now is I'm going to just assess you. I'm going to go through the different systems and ask you different questions and have you do different things for me, just so we can assess how you're doing. Okay? I saw you walk in here. You walked in here without any problems. You have good posture. You're alert, so I'm not worried about anything like that. You look like you're well nourished and you don't have any tics, involuntary tics. What I'm going to do right now is I'm going to check your muscle tone. So I'm going to have you move your arms for you first, and then I'm going to have you do some movements with your arms, okay? So first, I want you just to relax, okay? And I'm going to move your arms, the elbow, elbow. And then I'm going to have you move your shoulder. Okay, like this. Very good. Good. Let's test this one. So I'm going to move your wrist, and then I'm going to move your arm, elbow, and then I'm going to move your shoulder. Very good. Okay. Now I'm going to have you do some movements for me. Okay? Can you move your arm up like this and back? Okay, as far back as it'll go. Now move your other arm. And as far back as it'll go. And move your arm to the side. Up as high as it'll go. Very good. And the other arm. Now I want you to reach back like you're scratching your back. Very good. Now reach back behind like you're going to touch your scapula. Okay? Can you do it with the other arm? Very good. Now I'm going to check your pulses, okay? So I'm going to feel for your radial pulse, which is nice and strong. Even pulses. Check for your brachial pulse. Both are nice and strong and equal. No problems there. Okay. Now I'm going to check for nodes that are located right behind your elbow. Okay. I'm going to feel here for any nodes, and then I'm going to have you just relax your arm. I don't feel for any nodes. I don't feel any nodes there. Okay, same thing here. Okay, I don't feel any nodes. Just relax your arm. Relax. Okay. I don't feel any nodes there. Very good. Now I'm going to inspect your head, okay? First thing I'm going to look at is I'm going to look to see if there's any scarring, we're going to look for some symmetry to make sure that everything is symmetrical. To see if I see any lumps or nodes or anything that just stick out. I don't see anything, so now I'm going to palpate. Okay. Now I'm going to palpate your sinuses. Is that right?
No.
Okay. What about here?
No.
Okay. Now I'm going to feel for your TMJ joint right here. Now can you open your mouth and close it? Open, close. Alright, good. There's no popping. Now I'm just going to feel for your temporal pulse. Very good. When I look at your eyes, I don't see any cresting of the eyelids. Your sclera is white, nice and white, and your conjunctiva is pink. Okay. Very good. Okay. Now I want you to look at my finger. Okay. I want you to follow my finger wherever it goes. Okay, with your eyes. Don't turn your head, just your eyes. So I'm going to move it to the side. I'm going to check for nystagmus. There's no jerking with the eyes. I'm going to move up and down, back to center. I'm going to move this way lateral. There's no jumping, so no nystagmus to the eyes. Up and down, and back to center. And then I want you to follow my finger, okay?